Today I'm going over my use of the Minnesota manual dexterity test for rehabilitating my spaghetti wrist injury, and just going over my approach to rehabilitation and relearning how to use my hand. This is an extension of videos I've been putting online and kind of in support of my spaghetti hand injury timeline. I'm showing this because the nature of the injury. Circular saw across the hand, severing 15 to 16 structures. There's 2 yellow protectors showing the metal pins that were holding my hand on basically through my thumb, which left my thumb immobilized for 7 months, which I think has some lingering effects on ability to use it. And I'm going to reinstitute the Minnesota dexterity test as a therapy exercise, not as a diagnostic exercise. This is a technique, from my experience, probably not suitable for everybody. From the web, the description of this: the Minnesota manual dexterity test is a tool used to obtain baseline data on a patient. This test can also be used to document patient progress and or degree of disability. Probably something as a generic test for somebody with some dysfunction, but for the spaghetti wrist, severed median ulnar nerve, some disability should be probably presumed. And I believe the test's real value for me was developing some functional organization of my fingers. I started using the test at 15 months, so probably January of 2015. I had my injury October 27th, 2013. It is August 1st, 2018. I have not used this test recently. I'm going to reinstitute it. Over the next month, I'll post a second video trying to see what progress I can make, given there seems to be some structural changes in my thumb, but I don't know if you can have any sort of neuroplastic changes, or as far as functionality of tendons, if you can regain some of that at this later date. But this will be my approach to evaluate that and dealing with pinch technique. When I started using this for myself, initial attempts might have had me making it across the board just to here and then fatiguing. And I think that's one aspect of a spaghetti wrist injury. As you're rehabbing it, the muscles are going to be weak. You're kind of trying to bring along in tandem functionality and strength, with strength being lagging, functionality being slight when it does present itself, and kind of inching along both of those things together till you have capability. I think you could get a gist of this test. There's multiple videos available online on YouTube. They're primarily for student physical therapists, so be careful in trying to institute a student's basic understanding of this test and customize it for a really serious injury such as spaghetti wrist. Timing is almost certainly not going to be helpful initially. I think generally the medical community's comparison of data from a test like this, where their experience is going to be with larger populations of elderly or traumatic injuries that don't involve nerves or loss of neurological control of the hand, it's probably not going to be appropriate when you're trying to use this test as a rehabilitation exercise for a very small population of people with spaghetti wrist amputation type injuries who may be dealing with a neurological component that the general population doesn't deal with. And I believe the principles of neuroplastic training must be given a chance to manifest themselves, meaning if you do this test on 3 occasions, without any practice, where you're trying to develop the skill, which would mean develop, I mean neurologically reorganize things, I think you'd be missing the point. The idea is it's a very slight change over time, and build on it. What I have done over the last year or two is let go of some of my protocols that I went through to regain capabilities, and in just a deliberate manner, I'm going to spend the next month or two re-engaging. On that note, I have not practiced this at all recently, so you're looking at a raw attempt. My hand was a little tight when I set this board up, so I did go through my massage kind of protocols a little bit. I discussed massage in another video on YouTube in relation to spaghetti wrist injury. I will show in 1 second here. I use Uncker's medicated Sev, high menthol content, probably disrupt pain signals for people who are looking for non-NSAID compounds to change their pain profile. And this is a little wine cork I use to facilitate massage. And here is the injured hand, circular saw in here, all the way across, pretty much flop back, severed ulnar median nerve at the thumb, pretty much all the way amputated. I'm pretty sure it went through all the bones across, 15 to 16 structures. And then my ulnar artery is complete and perfuses my hand. My radial artery was clamped. I'm sure there's some different vascularization that's particular to me. To start the test, to go over the idea really quickly here, make the video as short as possible. I apologize for the length. I constructed this board. This is a dowel rod I cut up. I did this with the injured hand in the basement with a drill press. I would recommend somebody else either buy one or have somebody build them one. I think a patient with a compromised hand could vary the type of the peg, maybe slightly taller, maybe slightly wider, maybe multiple versions of this where you graduate the diameter smaller. You start with a wider diameter and then graduate it smaller to customize it to the patient's hand. If you watch the videos, students will talk about like a placement and then a turning test. I would abandon going a real rigid sense of how this test is going to go. It goes through 3 or 4 different types of turning the pegs. There's multiple tests with different pegs. This one worked well for me. Again, when I started, first time going across, I might have gotten to here and then had to stop. So I wouldn't feel bad. Maybe you go 20 pegs over and then your hand gets tired, and then if you can go 23, 25, 42. I think as a diagnostic test in a occupational setting, then you'll do like 4 repetitions of this. So if you're trying to use this as a return to work guide, you're going to have to do multiple cycles through the board of different turning tests or placement tests to show it. I think they place the pegs by putting the board out there, putting it back in. To use my left uninjured hand, placement could be as simple as grabbing it in whatever configuration they want. Using my right nearly amputated hand, do the same thing. If you start slowly, you may have different levels of functionality. You may have different mental profiles you try to achieve as you're trying to get, if you have some instability in your thumb, you're trying to get more stability, so you have to flex it a particular way. I have a bit of an adhesion or something, or a cross neurology, whatever it is, where my pinky will tend to want to drift a little bit. So, like if I don't watch it, perhaps my pinky would want to stick out there. Well, it doesn't have to. But initially, when I was doing it, you'd grab them and you'd have a real unorganized hand configuration, and I had to just learn with different muscle bracing techniques to do it. And then because my wrist was severed, I had to work on loosening my wrist up. So that was in the gym to get my wrist more mobile with a better range of motion to do the test. One thing you can do is measure, I think as you're trying to balance your hand out neurologically, meaning your hemispheres, the control you have over your left hand is presumably ipsilateral, so it's your right hemisphere of your brain. Control you have over your right hand, which is presumably your left. You would assume there's some differences when you sever the nerves, at least it was for me. As with everything, you know, if you can sit and do it with your non-injured hand to see the model, do it with your injured hand, trying to match the two up. You can try to do things together. And that right there, as you regain sensation, what happens with the peg is very slight sensation you almost instantaneously feel it as you putting the peg in. You may not have that level of sensation, so maybe your peg will go in sideways and you have to figure it out. As you go through the test, I would use opportunities. If I had a peg like that, my fingers have always been tight because of the nature of the injury. I believe the circuits are removed from tendons, so I had to lengthen the tendons. You can do different variations, which use your finger to push it in and then stretch it out. So and I'm just placing these back. I should do more ordered, but it's kind of whatever way it is I want to go. There's the board back together roughly, but you could do one variation if you had tight structures of your fingers, or you're trying to do like an idea for stretching the finger out, or like working, again, my fingers, the hands are always tight. This has been a problem. Just put a peg in and use it as an opportunity to stretch those tightened structures up. So stretch it, and it gives you an opportunity to, and you know, some of these I'm kind of almost deliberately not concentrating, trying to get it, but you can stretch your middle finger. I found that the end, towards the end of the digit, this is still a little tight, so this gives you an opportunity to kind of work those really tight structures, which will give you suppler hands, which will help you approach a subtle hand configuration, which is what all patients are going to want back, that you're not going to get entirely. Somebody who doesn't have the multitude of structural damage, perhaps somebody with a hand transplant may expect to have a better configuration of structures in their hands, so they don't have to deal with the specific tightness, but they may deal with the general tightness that they want to address. And that's it. There's different configurations you'll see online. There's different versions of this test. They're really rather informal, with different researchers coming up with their own formalized version of it. I just kind of wanted to show what I had done. This seemed to have helpful exercise in developing the organizational structure as you organize your fingers to pick something up. and then you do it in, you know, repetitive. I would have headphones on, so it's free from distraction. Setting as possible. This is one exercise I would go through. It's not going to be appropriate for everybody. Stimulation could be helpful, it could be hurtful. You want to make sure that it's appropriate for you, and of course talk to your medical professional if you want to attempt this to see if it's at all appropriate, or if they think you're at a point where you could do it. I was 15 months in and had experienced kind of some reorganization of the structures of my hand, and I was just trying to take that reorganization and standardize it into motion that I could employ in different tasks. And Minnesota Dexterity test here was one of them. Again, I hope this gives somebody an idea and that they can build on it. And I hope a medical professional who's trying to think about the particulars of a spaghetti wrist injury would realize that this isn't necessarily so much a diagnostic test as a progressive therapeutic test, which might have diagnostic attributes, perhaps filming it every so often with like a GoPro or some sort of film, and then reviewing it to see if change is manifesting itself would help a clinician aid a patient. Again, if you're dealing with this injury, as always, I wish you the best.